According to the CDC, an estimated 1 in 13 adults in the U.S. has developed what's known as long COVID symptoms. Many describe them as debilitating and say those symptoms can last months. Jacksonville infectious disease specialist Dr. Mohammad Reza is joining us now via Zoom. Good morning. Thanks for being with us.
Good morning. Thank you for having me.
Before we talk about local cases, would you explain the symptoms of long COVID, please?
Yeah, it's very nonspecific. That's the thing to be aware of. So people can have, this is months after you've recovered from the infection, about 3 months on average. People can have debilitating fatigue, difficulty breathing, that head fog, just can't think, can't function on a daily basis. So this is affecting people's everyday function that they can do to work, to care for their family. So there's multiple symptoms you can have.
Yeah, and it's the list was so long we couldn't even fit them all on the screen. I want to point this out: fever, coughing, and given that a lot of these symptoms are similar to other illnesses that are spreading in our community right now. So is there some way that someone knows it's long COVID?
Yeah, it's one of the key things is it's after you've recovered from COVID, about 3 months out. So it's something that when you are experiencing these symptoms, these recurrent fever, shortness of breath, write it down, talk to your provider, because it's something that needs to be talked about and found. There's no cure for it and there's no diagnosis for it. But at the same time, this is being underdiagnosed across the country at this point. So
is there a certain group or age or, anything that is more at risk of developing long COVID?
Yeah, we're finding out more and more as we're studying this and the effects of after COVID infection, but people that were requiring ICU level of care due to COVID infection, people with underlying medical conditions, people that, didn't get vaccinated. And that's one of the things we're seeing over and over again. And for those that experience this multi-system syndrome during or after the illness, they're more susceptible.
And those who have gotten vaccinated, and as we know, they can still get COVID, are they less likely, do you think, to develop long COVID as a result of them being vaccinated?
That's what the studies are showing more and more at this point. You can still get COVID, but a lot milder symptoms. What we're seeing is the longer you have this virus in your bloodstream, the more likely you can develop long COVID subsequent to the infection. So getting vaccinated decreases the chance of you getting infected, first of all. But the other thing is it can also decrease the amount of virus that's in your bloodstream.
That's an excellent point. So how common is this among local patients? What are you seeing and hearing?
It's luckily, we're not seeing a big rise in COVID cases right now, which is fantastic. But we're still seeing patients coming in with COVID and diagnosed COVID. One thing I really have to impress is that people should use these antiviral medications we have. One of the new studies that just came out earlier this month does show people that use a medication called Paxlovid, which is an antiviral, can decrease your chances of even long COVID by about risk reduction of about 25%. So I urge people to reach out to their provider if they start having symptoms, fevers, when they're diagnosed with COVID, with a rapid test or a PCR test. And more so, just ask for these medications, especially if you have underlying medical conditions that could have a bad outcome.
Given the fact that it can be a little difficult to figure out if this is what you're suffering from as opposed to something else, I mean, this is one of those, examples of kind of paying attention, is it not, to the symptoms, so you can have that conversation with your doctor. I mean, there's certain questions you should be asking yourself to kind of prepare yourself for that meeting with the doc?
It is. I mean, it's something we have to speak up for ourselves as patients to clinicians, because, writing down when your symptoms started, right? So other things are what makes your symptoms worse. How often do you experience these symptoms? If it's recurrent fevers, this is a shortness of breath, there's brain fog, abdominal pain, diarrhea. These are all symptoms that we really need to write down as we experience after COVID if you've never experienced it prior to the infection. Now, these are things that will help your provider to do appropriate tests. And a silver lining to all this is more research is showing that 75% of people who develop long COVID after the infection will likely, hopefully, go down after about 12 months. But this can last for a long period of time. One of the things that we also hear is loss of smell or taste. So this can last for months.
A reminder that there is a vaccine there available that can decrease your chances of being infected with COVID. Thank you, Dr. Reza, for your time this morning. We appreciate it.
Thank you so much.